Dr. SHADEY SALEEM. Welcome to Morocco, your second country. We're very, very pleased to have you amongst us. Could you please tell us the reason of your coming to Morocco?
Most welcome with you. I am very happy for these invitations for my country, Morocco, as all Egyptians consider Morocco is the main country for us. The Society of Endometriosis and Reproductive Medicine at Morocco invite me in the second international conference for this society, as the conference is international and invite many eminent figures from all over the world, and me from Egypt. So I'm very happy for this invitation, and I also talk about the endometriosis, which is a very huge problem for the ladies in the reproductive age.
That's great. Thank you very much for being with us. So you're consultant of obstetric gynecology and IVF. You're also president of the Arab Society of Fetal Medicine and Surgery and chief board of New Cleopatra Center for Women's Health in Masr in Egypt. So being the president of the Arab Society of Fetal Medicine and Surgery, what about fetal medicine?
Fetal medicine is a new science all over the world, which consider and treat the babies inside the uterus of the mother. As the human rights to treat this baby and to listen for any pain in this baby inside the uterus, as this baby cannot complain. So we must go for these babies to listen, to see this baby complaining from any disease or any congenital abnormalities. So we make in fetal medicine 3 times examination for the pregnant ladies at 12 weeks, first trimester scan to examine the pregnant lady and check if this baby have any chromosomal abnormalities as Down syndrome. All of us know about the Down syndrome. And at 22 weeks, at the 5th month of pregnancy, we must do examination for this pregnant lady to see the structures of the baby. We see CNS, face, heart, GIT, skeletal system, anterior abdominal wall, GIT, urinary system. All systems of the baby must be examined properly to see if there is any problem for this baby, as there is many problems can be solved intrauterine, and some problems need interventions immediately after delivery, and some problems there is no need for intervention. So second trimester scan now is important all over the world, and the third examination at 32 weeks to check about the growth of this baby, to check the water surrounding this baby, amniotic fluid, and also to check the placenta of this baby. These 3 times is very important to be done during pregnancy.
Perfect. So are these the benefits of fetal medicine, or are there other benefits of fetal medicine?
Benefits of fetal medicine is huge now all over the world, as we can see if there is any problem for this baby. Also, we can detect any disease can affect the ladies, as preeclampsia, which means hypertension during pregnancy. So we can do early detection of preeclampsia at 11-12 weeks of pregnancy, which is very important. As you know, there is more than 500,000 babies died every year per world, all over the world. And also there is 750,000 ladies died from this disease, preeclampsia. So this is very important for us to make early detection of preeclampsia at the 3rd month of pregnancy. Also, we can check the baby health, and if there is any problem, we can make intervention during pregnancy or after delivery.
So can we give actually drugs or medicine
Yes,
to
of course.
the fetus inside the mother's womb?
Yes, yes. The very important drug we can give for pregnant lady is folic acid, which is a type of vitamin B complex. This is very important. If this vitamin, folic acid, is deficient, this leads to congenital anomalies of the central nervous system of the baby, named the neural tube defect. So it is very important to give the pregnant ladies in the first 3 months folic acid every day. Also, we can give corticosteroid. This is for enhancement of the lung of the baby, maturity of the lung, which can given if there is any possibility for preterm labor. And also if there is arrhythmia, you know, arrhythmia means dropped beat, extrasystole, irregularity in the fetal heart rate of the baby. We can give for this baby anti-arrhythmic drugs to treat the arrhythmia of this baby. And many, many drugs can be given for babies inside the uterus of the mother.
Perfect. But can we make actually intrauterine surgery for these
Yes,
babies?
yes. I am president of the Fetal Medicine,
Yes.
Fetal Medicine and Surgery Society. Yes, we can do surgery intrauterine. The most common surgery we can do is intrauterine blood transfusion. The baby can be affected by fetal anemia. If this fetal anemia becomes severe anemia, this can lead to congestive heart failure, anemic heart failure. Anemic heart failure means the water present all over the body of the baby and end by death. So before the anemia becomes severe, we must make intervention by intrauterine blood transfusion. We put a needle in the anterior abdominal wall and enter in the uterus and enter in the umbilical cord of the baby and make intrauterine blood transfusion. Also, there is many other interventions can be done, as if there is stenosis in the valves of the heart, we can do it intrauterine, and many interventions can be done.
Thank you, doctor. What about endometriosis?
Yes, endometriosis is a huge problem all over the world, as about 10% of ladies in the reproductive age can be affected by endometriosis. Endometriosis, till now, there is no well-known cause for this disease. And this disease is a chronic disease, cannot be treated at all. This will, if the lady affected by endometriosis, will have endometriosis all his life or her life. Endometriosis can make 2 main problems. The first one is pain.
Okay.
And the second one is infertility. So pain can interfere with the quality of life of this lady. So we must make awareness in the population about this problem. If any lady with a known etiology of pain in pelvis or in abdomen must go to endometriosis clinic to check if this unknown pain from endometriosis or not.
Perfect. So the problem for women is mainly pain and infertility. So that's the problems that endometriosis could cause to women. Are there any treatments for this pain or this infertility?
Sure. My lecture in this conference about how make treatment for endometriosis. Pain, we can use analgesics, and also we can use hormonal treatment, and may use surgery if the analgesics and hormones not make a good control for this pain. we can make surgery for this lady. About infertility, this is a big problem really due to increased age of marriage for ladies all over the world. The main advice for any ladies with endometriosis to get married rapidly and to bring a child rapidly. Why? Due to endometriosis itself affects the quality of oocyte. Also, adhesions in the pelvis of the lady can affect the tubes and the fimbria of the tubes and can make tubal factor infertility. So the main advice for any lady with endometriosis to make rapid marriage and rapid getting children.
So there is hope for these women, and we can help them in many, many ways when there's endometriosis with pain and infertility.
Yes,
there are solutions.
Yes, there is hope. Yes, but this disease is a chronic disease.
Yes.
The ladies will suffer for a very long time from endometriosis. So please, any lady with endometriosis must go to endometriosis clinic.
Perfect. So that's why we are here in this Congress, to discuss more about these issues and try to find, actually exchange information.
Sure.
And try to find even more solutions for these women. Thank you very much, Dr. Shadey SALEEM in Masr, Egypt. It was very nice having you with us, and we hope we're going to have you with us again in the next Congress.
Yes, many thanks for you, and many thanks for all our colleagues at Morocco, and many thanks specific for you, Amira.
Thank you.
Welcome.
Thank you. See you soon.
Welcome.